Did you know that before I was a doctor, I chased tornadoes? I'm serious. I worked with the National Severe Storms Laboratory. I flew in research aircraft. I helped rebuild actual government-owned storm-chasing vehicles that drove into severe weather while everyone else was driving away from it. And I know what you're thinking. How does a storm chaser end up helping women figure out their hormones and their supplements? Fair question, but here's the thing. The skill set is almost identical. When you're forecasting severe weather, you never make a call based on one data point. You don't see a dark cloud and go, oh, yep, tornado. You're looking at pressure changes, dew points, wind shear, rate of return, surface observations, what the atmosphere has been doing for the last 6 hours, and at different levels of shear. You're building a complete picture. You're looking for patterns. And that's exactly how I approach a woman's health. Because her body, it's leaving clues everywhere. We just have to know how to read them. Hi, I'm Dr. Emily Wheeler. So that's what this podcast series is about. The Supplement Playbook. 3 episodes, and by the end, I want you to think about your supplements completely differently than you did before. Not as hope in a bottle, per se, not as something you're taking because your friend swears by it, but as actual tools, with jobs, with purposes, and with a plan behind them. So let's get into it. I want you to meet someone. I'm going to call her Sarah, okay? Sarah is sharp, she's motivated, she genuinely cares about her health. She has done the research, she's listened to the podcasts, she's read the articles, she is trying. But if you open up her supplement cabinet right now, guess what? It looks like a small health food store exploded in there. Do you resonate? Fish oil, magnesium, berberine, ashwagandha, a greens powder, a probiotic, vitamin D, adrenal support, hormone support, and probably 3 or 4 more things she can't even remember starting. And yet, she's still tired, she's still bloated, she's still feeling off, she's still frustrated that she's doing all the things and nothing seems to be working. So here's what I want you to hear, because this is important. The problem is not that Sarah needs more supplements. Sarah needs a plan. And honestly, most of the women I work with are exactly like Sarah. Smart, motivated, educated, overwhelmed, and doing their best with information that was never really designed to help them succeed. It was designed to sell them the next bottle. So let's change that. Conventional medicine is really good at one question. What disease do you have? And it's excellent at treating that. Infections, fractures, emergencies. Conventional medicine is extraordinary. I want to be clear about that. But for the woman who is exhausted, even after a full night's sleep, gaining weight despite doing everything right, losing hair, waking up at 3 a.m., dealing with anxiety that came out of nowhere and whose labs all came back normal, that model leaves her empty-handed. Functional medicine asks a different question. Not just what, but why. Why is your body producing this symptom right now? What is it trying to tell you? What system is under stress? What's missing? What's too much? What's the bigger pattern here? It's the same instinct I had standing in a field in Oklahoma, looking at a storm. You just don't describe what you see. You ask why it's forming. What conditions created it? What's about to happen next? And supplements in that world are tools, really useful tools when used correctly. Like any tool, the right one for the right job is powerful, but a hammer is only useful if you're dealing with a nail. The wrong tool to the wrong job and you're just making noise. So the first thing I want you to carry out of this episode is really one idea. Stop collecting supplements, start building a plan. Okay, so this is where things get a little spicy because the supplement industry does not love when practitioners talk about this. Quality. It varies wildly. And I mean wildly. There's no FDA pre-approval process for supplements the way there is for medications. Companies are largely policing themselves. Some of them do a great job, an incredible job. Rigorous third-party testing, pharmaceutical-grade manufacturing, verified purity. Others, not so much. Let me give you an example that always gets people's attention. Fish oil. It's one of the most popular supplements on the planet. It also might be one of the most commonly rancid supplements on the planet because fish oil oxidizes. And when it does, it doesn't just stop working. Oxidized fish oil may actually work against you. So how do you know if yours is rancid? Well, bite into a capsule. If it smells or tastes like something that washed up on the beach, That's your answer. The bottle at the grocery store and the practitioner grade bottle can look nearly identical. The same claims on the front, but a very different story inside. So what do I look for? I look for third-party testing, GMP certified manufacturing, and that stands for Good Manufacturing Practices, GMP. Testing for heavy metals and contaminants, and companies that are transparent about where their ingredients are coming from. That cheap supplement feels like a deal until you realize it's not doing anything, or worse, until you're realizing it's doing harm. That's when it becomes the most expensive supplement you ever bought. So this is my favorite thing to teach because it genuinely surprises people every single time. The body doesn't care what the label says. The body cares what it can absorb. This concept has a name, bioavailability, and it basically means how much of what you swallowed actually makes it into your cells and does anything useful. I used to think about this in weather research a lot. Actually, we deploy instruments into the field to collect atmospheric data. But if that instrument wasn't calibrated right, if the signal wasn't transmitting correctly, if the data was corrupted on the way back, it didn't matter that the instrument was technically out there. The data wasn't usable. Same thing with supplements. You can swallow something every single day, and if your body can't absorb it, do you know what happens? Expensive urine. That's what it becomes. I know it's not glamorous, but it's true. And here's what this looks like in practice. So iron bisglycinate is absorbed significantly better than basic ferrous sulfate and causes far less nausea and constipation that make people quit taking iron altogether. Sublingual B12, the kind that dissolves under your tongue, it bypasses the digestive system, which is a huge deal for people with low stomach acid. Ubiquinol, the active form of CoQ10, is dramatically more bioavailable than ubiquinone, especially as we get older. Our bodies become less efficient at converting between the two. And curcumin, which is the active compound in turmeric, it's not the same as turmeric itself, by the way. It's notoriously hard to absorb on its own. The delivery system changes everything. But here's the part that's easy to miss. Your ability to absorb any of these is also happening, and it's also shaped what's happening in your gut. Low stomach acid, which is far more common in women over 40 than most people realize, impairs the absorption of iron, B12, magnesium, zinc, and more. Gallbladder dysfunction affects how you absorb fat-soluble nutrients like vitamin A, D, E, K, and omega-3s. Gut inflammation, celiac, IBS, all of it changes how nutrients move through your system. So your friend takes magnesium and feels amazing. You take the same magnesium and feel maybe nothing. The problem may not be the supplement. The problem may be something happening upstream that nobody's looked at yet. This is why I like to say over and over again, your friend is not your lab result. All right, let's make this actually useful here. When I'm evaluating a supplement for a patient, for myself, for anyone, I run through 5 questions. I run through a lot, but I'm going to start with these 5, and I want you to have these questions. Number 1, who made it? Can you trust this company? Are they doing third-party testing? Are they testing for heavy metals and contaminants? Are they transparent about how and where things are manufactured? This doesn't need to be complicated, but it does need to be asked. Number 2, what's actually on the back of the label? The front of the supplement label is marketing. The back is information. Look at the supplement facts. How much of the active ingredients is actually in there? Is it in a form that your body can use? Then scroll down to the other ingredients at the bottom. This is where the fillers, the binders, the artificial colors, and unnecessary additives hide. Things like maltodextrin, dicalcium phosphate, artificial dyes, excessive binders. If you see a long list of things that have nothing to do with your health, that's a red flag. Don't buy labels, buy the active ingredients. Number 3, how is it delivered? This goes back to bioavailability. Generally speaking, liposomal and nano delivery systems tend to have the highest absorption, then liquids, then capsules and soft gels, then tablets. That's not a hard rule. There are great tablets in poor liposomal products, but it's a reasonable starting framework, okay? Number 4, is there enough to matter? Oh, this one. This one drives me a little crazy. So there's a practice in the supplement industry called pixie dusting. A company takes a popular research-backed ingredient and sprinkles just enough of it into a formula to list it on the label. Think multivitamin, okay? Not enough to actually do anything, just enough to be technically present, to be marketable, and to look beautiful on a large product. You see this all the time in greens powders, combination formulas, multi-ingredient blends. 30 ingredients are listed, most of them in amounts so tiny and so small they couldn't possibly have a therapeutic effect. But you wouldn't know that because you're not used to looking at labels all the time. So we want to get you there. So always look at the actual dose, then ask, does this match what the research actually supports? And this is really the same idea as the last question, just at a different angle. Don't buy labels, buy active ingredients. Here's number 5. Does it have a job? This is a big one, the one that changes everything. Why are you taking this? What specific job does it have? What are you hoping it will do? If you can't answer that clearly, it might be time to have a conversation about whether it belongs in your routine at all. Every supplement should have a purpose. Here's where I want to bring it all together. When I'm building a supplement protocol with a patient, I'm not going off what's trending. I'm not going off what worked for someone else. I'm pulling from 3 things, and all 3 matter. Your symptoms, fatigue, brain fog, hair loss, poor sleep, anxiety that came out of nowhere, bloating, joint pain that gets worse in the morning, low libido, cravings you can't explain. These aren't random, they're clues. They tell me where to look, but, and this is important, they don't tell the whole story on their own. We have to look at your history. 2 women can walk into my office with identical complaints of fatigue. One had her gallbladder out 10 years ago. One has been on acid blocking medication for years. One has a history of Hashimoto's. One has been under enormous stress for the past 3 years. Same symptom, completely different story underneath it. Completely different plan. And your labs. This is where we move from guessing to actually knowing. So ferritin, your iron storage, is one of the most commonly missed causes of fatigue and hair loss in women over 40. It can be tanked even when your regular iron looks fine. Vitamin D, omega-3 index, homocysteine, thyroid markers that go beyond TSH, blood sugar regulation, Dutch hormone testing. These aren't just numbers. They're the rest of the forecast. Back in my storm chasing days, we never called the tornado watch based on one observation. You need the full atmospheric picture. What the pressure was doing, what the moisture was doing, where the wind was shifting. One data point tells you something, but multiple data points tells you the story. Your body works exactly the same way. Symptoms tell me where to look. Labs help confirm the story. So here's where I want to leave you after this first episode. The supplement industry is very good at making you feel like the answer is always the next bottle. One more product, one more formula, one more thing you haven't tried. Functional medicine says something completely different. Your body is unique. Your history is unique. Your story is unique. And your supplement plan should reflect all of that. In the next episode, we're going to talk about something that surprises a lot of us. Because even when you choose the right supplement, you can still use it completely wrong. We'll talk about dosing, timing, how to know if something's actually working, and why more is almost never the answer. I'm Dr. Emily Wheeler. Thanks for being here. And remember, your body is talking. Let's keep listening.